Today's medical-centric topic is Fibrolamellar Hepatocellular Carcinoma. What younger patients need to know. A rare liver cancer that affects healthy young adults. Fibrolamellar Hepatocellular Carcinoma, FLC, is a rare form of liver cancer that mostly affects teenagers and young adults, typically between ages 10 to 35. Unlike regular liver cancer, it often appears in people with no history of liver disease, no cirrhosis, and no alcohol or hepatitis-related issues. Because of this, symptoms are subtle and diagnosis often happens late. What makes FLC different? FLC is biologically distinct from classic hepatocellular carcinoma, HCC. Key differences. Occurs in young, otherwise healthy individuals. Liver function tests may be normal. Alpha-fetoprotein, AFP levels are usually not elevated. Tumors tend to be large at diagnosis. Driven by a genetic mutation called DNA JB1 PRKACA fusion. These differences mean standard HCC guidelines don't always apply. Early signs young patients often miss. Symptoms develop slowly and mimic common digestive or stress-related problems. 1. Persistent abdominal pain, especially in the upper right side, often dismissed as acidity or a muscle strain. 2. Unexplained weight loss, a common early marker of metabolic stress. 3. Fatigue or low energy, caused by the tumor's metabolic demands. 4. Palpable abdominal mass. Some patients notice fullness or swelling. 5. Nausea or loss of appetite. Happens as the tumor grows and compresses nearby structures. 6. Elevated liver enzymes, sometimes. But many patients still have normal blood tests, making diagnosis tricky. How FLC is diagnosed. Because AFP is usually normal, doctors rely on imaging and biopsy. Diagnostic tools include CT or MRI scans showing a large mass with a central scar. Biopsy confirming the fibrolamellar pattern. Genetic testing for the DNA JB1 PRKACA mutation. Early detection is challenging because it isn't picked up during routine liver screening. Treatment options. 1. Surgical removal. Primary treatment. Complete resection offers the best chance of long-term survival. Many young patients tolerate surgery well. 2. Liver transplant. Considered when the tumor cannot be safely removed. 3. Targeted and systemic therapies. Traditional chemotherapy often has limited effect, but emerging options include mTOR inhibitors, immunotherapy, clinical trials targeting the fusion gene. 4. Treatment of recurrence. FLC has a high recurrence rate, so repeated surgeries or ablation may be needed over time. Monitoring and long-term outlook. Regular imaging, MRI, CT, every 3 to 6 months is essential after treatment. Younger patients often have good baseline health, improving recovery, but long-term oversight is critical due to recurrence risk. When to seek medical attention. Persistent abdominal pain. Unexplained weight loss. Abdominal swelling. Fatigue with normal blood tests. A mass felt under the ribs. These symptoms should never be ignored in young adults.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.